Zang, The Organ System of Traditional Chinese Medicine by Jeremy Ross. Page 195. Chapter 16. Disharmonies involving more than one Zang. Disharmonies of two Zang together. This section investigates the commonly occurring patterns of disharmony involving two Zang together. Xin and Fei. Deficient Qi of Xin and Fei. Shen and Fei are intimately associated in two main functions: formation of Qi and Xue, movement of Qi and Xue. Formation of Qi and Xue. Both Xin and Fei are involved in the formation of Qi and Xue in the chest, as discussed in Chapter 3 and summarized in Figure 16.1. Movement of Qi and Xue. Zhong Qi, the Qi of the chest, gathers in the chest, forming the Sea of Qi. It regulates the movement of heartbeat and respiration, and assists Fei and Xin respectively in the movement of Qi and of Xue throughout the body. Hence, their Chongqi, Xin and Fei are intimately related, both in health and in disease. Deficiency of Qi, of Xin and of Fei often occur together, with the simultaneous occurrence of such signs as palpitation and shortness of breath. Their Chongqi, factors tending to weaken Xin, will tend to weaken Fei, and vice versa. Also, their Chongqi, various factors tend to weaken Xin and Fei simultaneously. Some of these are outlined in Table 16.1, along with appropriate remedial actions. Signs. Deficiency of Qi of Xin and Fei may occur, for example, in chronic cardiac insufficiency with bronchitis, and signs may include palpitations, spontaneous perspiration, shortness of breath, asthma, weak cough, weak or frail pulse, pale tongue. Table 16.1. Chongqi, Fei and Xin. Disease factors: poor posture and breathing, which remedy are correct posture, breathing exercises. Disease factors: contained air, contaminated air, which remedies are wear mask, adjust working conditions. Disease factors: smoking, which remedy is stop smoking. Disease factors: external cold, remedies is keep warm. Disease factors: lack of exercise, the remedies is sufficient appropriate exercise. Disease factors: chest injury, remedies are appropriate treatment and remedial exercises. Disease factors: emotional disturbances, remedies are support, counseling, treatment, and time. Xin and Pi, deficient Xinxue and a deficient Piqi. If Piqi is deficient and fails to produce sufficient Xue, deficiency of Xinxue may result, with involvement of signs of deficiency of both Xinxue and Piqi, as in some forms of anemia, insomnia, and cardiac insufficiency. Signs. Signs may include palpitations, dull pale complexion, insomnia, lethargy, poor appetite, loose stools, weak or thin pulse, pale tongue. Xin and Shen, deficient yang of both Xin and Shen. Shen yang deficiency may occur with deficient Shen yang, or may be originated or aggravated by it. This combination may progress to stagnant Xinxue, collapse of Xinyang, or to additional involvement of Fei, with water radiating to Fei. This combination may be seen in certain cases of cardiac insufficiency. Signs. Signs may include palpitation, feeling of cold, edema of limbs, face in the eyelids, scanty hearing, frail, minute, knotted or intermittent pulse, and pale, floppy, moist tongue with white coat. Xin and Shen. Xin and Shen not harmonious. The balance of fire and water, Xin and Shen, may be looked at in terms of the polarity of yin and yang within each Zang, so that each has its fire and water aspect. Alternatively, the relationship of mutual support of fire and water, mutual support of Xin and Shen, may be seen in terms of a polarity where Shen is predominantly water and Xin is predominantly fire, each supporting the other. If these yin-yang, fire-water relationships are balanced, Xin and Shen are in harmony. If, for example, Shen Yin is deficient, then it cannot control and cool Xin fire, which then flares up with signs such as insomnia and irritability. In such case, where both Shen and Xin Yin are deficient, Xin and Shen are said to lose communication, as in certain cases of insomnia. Signs. Signs may include palpitation, irritability, insomnia, dry throat, night sweats, lumbago, thin rapid pulse, and red dry tongue with a little cold. Xin and Gan. Deficient in or of Xin and Gan. Shen and Gan are the two Zang Fu most concerned with the maintenance of emotional harmony. Emotional disharmony may give rise to disharmony of Xin or Gan or vice versa, whether the emotional disharmony is depression or mental irritation. Since mental irritation may originate deficient in of both Xin and Gan, these two patterns often occur together, often in combination with deficient Shen in, as in certain cases of insomnia or menopausal problems. In more extreme cases, severe anxiety, depression, and anger may give rise to blazing fire of Xin and Gan, which rises up the body, accompanied by phlegm, and obstructs and disturbs Shen with signs of violent insanity. Signs. Signs may include restlessness, excitability, irritability, insomnia, headache, night sweats, wiry thumb and rapid pulse, and red tongue, especially at tip and with red dots on the sides, which is dry with a little cold. Shen and Gan. Deficient in of Shen and Gan. This combination is a common forerunner and associate of a previous combination. If Shen In is deficient, then Gan In will not be properly nourished, and Gan Yang will not be properly controlled as in hyperactive Gan Yang. Also, In may not properly control fire, resulting in blazing on fire. Both hyperactive Gan Yang and blazing on fire may lead to stirring of Gan wind. Hence, deficient Shen Yin may allow Gan Yang, fire and wind, to rebel upwards, combining with phlegm to disrupt and obstruct the qi in the channels of the head and confuse the mind and senses. This is seen, for example, in epilepsy or CVA. This combination of deficient in of Shen and Gan may also occur in chronic glomerular nephritis, abnormal uterine bleeding, and amenorrhea. Signs. Signs may include headache, vertigo, anger, insomnia, red cheek, hot palms and soles, painful flanks, sore back, perhaps hemiplegia, wiry thin and rapid pulse, and red tongue with a little cold. There is a less important pattern of deficient Xinqi and deficient Danqi, with signs of insomnia, timidity, dream-disturbed sleep, tendency to waken in fright, wiry thin pulse, and pale tongue. This pattern combines the fearfulness of deficient Xinqi with the timidity and lack of confidence of deficient Danqi. This combination is seen in certain cases of insomnia. Gan and Pi. Gan Invades Pi. There is a close relationship between the free-flowing function of Gan and the transforming and transporting functions of Pi. If the free-flowing function of Gan becomes impaired, depression of Gan Qi and the associated retardation and stagnation of Qi flow tends to depress the digestive function of Pi anyway. Although this is termed Gan invading Pi, Dan and Wei may also be invoked. There may also be the additional association of blazing on fire and blazing Wei fire, and of dump heat in Gan and Dan, and dump heat accumulating in Pi, depending on the circumstances. If P is deficient, then Gan is more likely to invade. Hence, the headaches and irritability that accompany hunger in some individuals that are reduced after eating. This pattern is seen in various cases of indigestion, vomiting, diarrhea, and abdominal pain. Signs. Signs include irritability, moodiness, soreness and distension of chest and flanks, nausea, vomiting, abdominal pain and discomfort, flatulence, loss of appetite, loose stools, wiry pulse, and dark or normal tongue with white coat. Pi and Shen, deficient Pi Qi and deficient Shen Yang. Shen is responsible for the prenatal constitution. Pi is responsible for the postnatal constitution. Shenjin is needed to activate digestion, and the process of digestion is required to supplement the replenishable postnatal aspect of Jin. One of the important functions of Chongmai is that by connecting Shen with Pi, it links prenatal or congenital qi to postnatal or acquired qi, and hence is clinically useful in cases of weak digestion linked to poor constitution. The transforming and transporting functions of Pi depending on Pi Yang, and hence on Shen Yang, reforming, activation, and movement. If Wei and Pi Yang are the deficient, the transforming and transporting functions of Pi will be impaired. Qi and Xue formation will be deficient. Jinye will not be properly metabolized, and turbid Jinye will accumulate with formation of edema and phlegm. This pattern is seen in various cases of edema, diarrhea, anemia, pelvic inflammatory diseases, and acute glomerulonephritis. Signs. Signs may include cold limbs, cold sore lower back, edema, difficult urination, perhaps clear leukorrhea, loose stools with undigested food, weak deep pulse, and pale, flabby, moist tongue with white coat. Qi and Fei, deficient Pi Qi and deficient Fei Qi. Qi and Fei are linked in the formation and movement of Qi, Xue, and Jinye. Qi sends good Qi up to the chest where, under the influence of Xin and Fei, Chongqi, Zhengqi, and Xue are formed. Also, Qi sends up the pure fraction of the fluids to Fei as vapor. Fei is involved in the formation of Qi and Jinye and is responsible for their proper distribution throughout the body. If Pi Qi is deficient, then Fei Qi, which depends on Gu Qi to nourish Chongqi and Sen Qi in the chest, will tend to become deficient. Also, it's said that Pi forms phlegm and Fei stores it. If phlegm forms due to weakness of the ability of Pi to transform and to transport Jinye, phlegm may accumulate in Fei if Fei Qi is deficient and the dispersing power of Fei is weak. Furthermore, damp tends to accumulate if Pi Qi is deficient, and if Fei cannot properly perform its descending function of sending fluids down to Shen, edema may develop. This pattern is seen in certain cases of convulsions, malnutrition, and edema. Signs. Signs may include lack of energy, loss of appetite, shortness of breath, cough, asthma, copious thin white phlegm, loose stools, edema, weak pulse, and pale tongue with white coat. Fei and Shen, deficient Fei Qi and deficient Shen Yang. This combination is known as Shen unable to grasp Qi. The descending function of a Fei is responsible for sending Qi down to Shen. Shen is responsible for receiving and holding the Qi. If Shen Qi and Yang are weak, and Shen does not properly grasp the Qi, it rebels upwards, impairing the Fei function of respiration, resulting in asthma. In addition, if Shen Yang is deficient, the actions of Shen, Qi and Fei in transforming and circulating Jingye will be impaired. Fei will not properly send liquids down to Shen, nor Shen sends vapor up to Fei. This will result in the accumulation of dump, edema, and urinary problems. Alternatively, Shen Yin may not properly nourish Fei Yin, and if Fei Yin is deficient, Fei may become dry, hot, and inflamed, as in the deficient Yin forms of pulmonary tuberculosis or the fire form of diabetes mellitus. Signs. Signs may include asthma, difficulty inhalation, shortness of breath aggravated by exertion, spontaneous sweating, cold limbs, low voice, listlessness, weak or frail pulse, and pale, flabby, moist tongue. Gan and Fei. Gan fire invades Fei. Blazing of Gan fire may flare upwards and affect the descending function of Fei, causing coughing, and the dispersing function of Fei, causing dryness. Also, the heat may cause Xue to leak from Xue Mai, so that there may be coughing of blood. Signs. Signs may include irritability and gongar, burning pain in chest and flank, dry throat, coughing blood or phlegm with blood, red eyes, bitter taste, dark urine, constipation, wiry rapid pulse, and red tongue with a thin dry yellow coat. In addition, there is the relationship between Gan and Fei based on the Fei function of governing movement of Qi and the Gan function of free flowing of Qi. Hence, both Gan and Fei are affected by emotional depression, sadness, melancholy, and grief, with the associated depression of a movement of Qi and stagnation of Qi in the chest. In the case of Gan, depression of Qi would be more associated with depression, frustration, irritation, frequent signing, digestive and menstrual problems. In the case of Fei, depression of Qi would be more associated with grief, melancholy, sadness, lack of Shen, weak voice, sobbing, restricted breathing, and Qi deficiency as well as stagnation. The predominant pattern would depend on the emotional predisposition of the individual and on the circumstances.